Good afternoon. Thanks for tuning in today. My name is Jeff McKay with Brightsquid. I'm going to be sort of taking us through this webinar today. We're going to look at moving forward with virtual care as part of our series on virtual care that we're running every Friday afternoon. Because as things open up in healthcare after COVID-19, we're starting to see clinics reopen in limited ways. We know that virtual care will continue, and we want to look at what you need to consider in your practice as we do that. Quickly before we start, we just want to look at audio settings. So if you can't hear us, make sure you're clicking on computer audio. You can dial in, and no audio, you're not going to be able to hear anything that we do. So make sure that you've got your audio configured there. So plants are reopening in Canada. We know that, dentists are starting to open up, physios. I got a notice from my physio clinic today, and allied health and general healthcare practices are opening up. Surgeries are starting to come in, elective surgeries. And so we need to look at what the considerations are for that, and how you're going to manage your virtual care going through that. So with me today, we have Rohit Joshi, Brightsquid CEO, who is a legal expert in privacy compliance, who's been working with clinics for a couple of decades on virtual care implementations, how to get moving in that sort of situation, what the legalities are around that, and Ingrid Rise, who is a privacy expert in Alberta and across Canada, who's consulted thousands of clinics and different healthcare organizations, as well as regulators on privacy compliance. So I'm going to bring them both in here now. So Ingrid and Rohit, welcome. And we'll talk about moving forward in the short term and the implications of reopening clinics, expanding sort of your presence in the community, getting more patients back in line. The issue of COVID-19 has forced a lot of clinics to adopt virtual care quickly, and now it's kind of time to be thoughtful about that. So Rohit and Ingrid, what are your thoughts around some of these comments here?
Thanks, Jeff. So let's start. I think the real challenge that many of the clinics that we're talking to are going to face is that there's a sense of apprehension, and that apprehension is going to be from the staff, from the employees of the clinic, so from people who are coming in to do anything from, replace your supplies to your IT work, not to mention your patients. And so I think in the short term, there's a number of considerations around how do we create the right environment of safety for everybody that's going to be entering into the system. We know that there is into your physical space. We know that social distancing is going to continue to restrict for the foreseeable future the number of people in a particular area. And we also know that screening is going to be a part of what's going to occur. Now, this has a pretty important implication on your privacy and on your privacy policies, because you have to make sure that you're not treating people inappropriately or one-off or anything like that. So you want to make sure that you've got proper policy thinking in place here so that you can post this policy and say, here's how we're going to handle patients into our clinic. And as a staff, here's what's expected of the staff to make sure that we don't contribute to the spreading of that. Now, the reason this is so interesting in virtual care is that a virtual care still allows people to be treated from their home, and it still allows providers to remain relatively safe because they're able, the providers are able to deliver healthcare without having to see the patient. So there's two things going on here. One is prioritize the patients that you have to see in person. But the other is how many can you see virtually so that in fact you don't take that extra amount of risk by having them come into the clinic. Ingrid, I'll turn it over to you. Nice to be on another webinar with you, but your comments around that.
Well, and don't forget that a lot of this can be triaged. For example, you can already do a virtual visit prior to or send a secure mail, ensuring that these patients are okay prior to coming in. and keep them informed, or keep them informed that one patient previously was tested positive, this is what we're going to do. So this virtual care is not just for COVID-19. It will be going on for a long time. So please make sure your privacy is in place to sort of enable you to use it efficiently, effectively, but allowing patient consent and understanding.
I think that's
Well,
a
and
great. Oops, go ahead.
yeah, I was going to follow up, and I think there's a level of due diligence in messaging patients in advance and collecting a record of that communication, right? That you have that through Secure Mail allows you to do that as you conduct those, tests and checks beforehand as people come in.
Yeah, and that's exactly the point. I mean, it does not negate the need for privacy, but you can actually utilize this as an effective tool to protect people coming in, as well as ensuring that they're aware of what their rights are.
Yeah, and I think when people talk about, the new normal, I think that there's lots of different motivations for the new normal, and the new normal will be with virtual care, right? If physicians are advocating for it, governments are advocating. I think patients are going to be advocating for it. So it's part of that new normal. So absolutely right, Ingrid, and trying to set up the fact that here's part of the new normal is going to be dealing with patients in this way. It allows us to take not a week by week or a day by day view of it. It actually allows us to think about how that's going to change the policies, the procedure, the privacy of our clinics.
Yeah, and this statement says it all. Like, patients have had a taste of this convenience, and many of them don't want to come back. And we've seen a huge drop in the people going to emerge. Could you imagine the benefit of having a normal emergency department where non-urgent treatment can be done virtually? So I think this is case in point.
Yeah, the system impacts are pretty amazing when you start to think through it that way.
Yeah.
And I mean, even if you just look at our own statistics, the number of messages originating from patients on our system is skyrocketing. The chart is pretty steep right now. So they're adopting this very quickly and happily, and it is going to be, I think, a challenge if anybody tries to rein that back.
Yeah, and I think Jeff, just before we leave sort of that thinking, the motivation right now might be, I don't really want to go into the clinic because I'm concerned about COVID. Or I think this takes a slide, which is where this slide takes us, is beyond that motivation. What is that new normal look like? Because listen, we're going to become comfortable with the level of risk of COVID-19. There's no question of it. We're going to become comfortable with it. But what does that mean for virtual care in your clinic? And as Ingrid has said, I think patients have a taste for it. Frankly, a number of physicians and dentists and physiotherapists that I'm talking to have also now got a taste for it. So let's talk about what that looks like permanently. So, not surprisingly, from Brightsquid's perspective, if we're looking at this as in a long term, we have to make sure that it continues to comply with the laws. No laws have changed because of COVID. The laws for compliance that were there the day before we started the pandemic are going to be there the day after. And although many people have talked about it in between, the laws have not changed. So you have to start thinking back in terms of, if this is the new normal, how do we make sure we've got consent to do the testing that we need or to get the information? How do we have the right consents to use virtual care? How can we make sure that we've got the right workflows that are not just going to sustain our clinic, but actually are going to help improve the level of care that we could have delivered as a clinician? Now, the patient onboarding is especially interesting because this, I would say, is as much a challenge from the clinic's perspective, and probably more a challenge from a clinic's perspective than the patient's. We're seeing wild adoption from a patient perspective, but in order to get patients using it, we have to get the clinicians using it. And so, how do you make sure that when you're doing an encounter, when you're communicating with that patient, that you've completed a certain amount of a certain task or a certain encounter? How do you record that? And how is that different than what you've done before, if at all? And I think, Ingrid, I'll ask you to talk about that point in particular. And
Right,
then,
and,
go ahead.
oh, sorry, go ahead.
No, all yours.
So I do agree that there is a slight alteration in the way you onboard patients and do all that. But the truth is, it really doesn't change dramatically. You take that record and you put it into your EMR, or you take that record and it is just like a patient visit. It's just virtual. It's whether it's secure communication or whether it's them emailing you. And then that virtual front desk is the same as your receptionist. So nothing really, in essence, changes except your mindset.
And I think that was the point that you and I talked about, Ingrid, which was we're getting also many discussions about, should I record on video my virtual encounter? And as both you and I spoke about, it's like, well, why would you do that now? Because you've never recorded any other visit.
Exactly.
And so we shouldn't be caught by the technology in order to create a new way of recording. I think there's been, for many years, there's been a process that the clinic is going through. Although there is a few changes here because it's a different way of doing business, let's not start over. You've already got a well-running clinic. Let's figure out how we're going to use new tools to run it as efficiently as you have in the past.
Yeah, and in most cases, more efficiently, because you now don't have a backlog in the waiting room. You don't have longer time. You communicate with your patient directly, securely. What more could you want?
Yeah. And I think as a final point here, there is some thinking about how do you now incorporate this permanently into your clinic with respect to, what's an expectation of a response time? Do you commit to getting back to your patients the same day? Do you commit to getting back to them within 24 hours? All of those things are important because it creates a level of expectation between the clinic and the patient. This is, after all, a new way of communicating for most of your patients. They need to know the hours that you're working. So it's really small and basic things that set the right expectation between you and your patients.
Yeah, and I mean that's an interesting point too, because in Alberta, I know for sure when you're looking at some of the health service codes connected with things like virtual care around secure mail, there is an expectation that there's a conversation with the patient up front about how this system works, what we're going to use this communication for, which is really no different. Going back to things don't change a whole lot. It's no different than when you bring a new patient on at your clinic. You've got someone new, you walk them through, here's how we operate, here's what we're going to do for you, here's what you're going to do for us. So it's just a slight update in terms of that, like here's how we're going to use this. And when you secure mail us, we'll get back to you within 2 hours or whatever it is. And I know a lot of clinics do schedule that sort of secure mail inbox review. So at 8 o'clock in the morning when we come in, we're going to look and see what messages came in through the night, and maybe we'll check in again at 10:30, or maybe we'll check in at noon, and we have scheduled time so that we can live up to those response times and set that patient expectation, so that we know that we're catching everything as we come through the shared inbox.
Yeah, and it also demonstrates it's just such an efficiency, not only from a patient point of view, but a clinician point of view. The travel time, the reduction of the workload, everything is a huge benefit. And that's what we really discovered during this COVID-19, that this really came to show us where some of our expectations were a little off. And now we see a better way to do business. We need to continue to utilize that better way of doing business.
Yeah, and Ingrid, just quickly before we move on to our final slide, we talked last week about the privacy, more of the privacy considerations in depth, and that recording is available on the Brightsquid website. But in terms of consent here, what are the regulations around how that should be recorded and the differences between verbal and written?
Well, you send out a secure message, and in there outlines all of the expectation from a patient point of view, and they provide their consent. So consent does not change, whether it's in person or virtual. So you still need patient consent. Always preferable in writing, and that's the advantage, of course, of secure mail, because guess what? It is in writing. So it's always best to have it in writing from a legal point of view, and as legal counsel, Rohit can explain that for sure.
No, I think you said it all, and I know that we're out of time, so.
Yeah, we're just at the end. So, let's keep your practice connected and safe. That's kind of the big issue here is like as we go forward, making sure that you're operating compliantly. If you want to do a quick risk assessment, get a sense of your score from a privacy and security standpoint, you can do that on brightsquid.com and just take our privacy risk assessment. And one of our onboarding representatives will get in touch to review your score and look at ways that you can improve it. So thanks for listening today, everyone. Rohit and Ingrid, thanks again for your time and your expertise in this. And this webinar will be available on brightsquid.com early next week.
Bye, everyone.
Thank you. Stay safe.